Welcome to Rubber Bands, an Avenues Recovery podcast. Conversations about the push and pull of addiction and recovery. And now, here's your host, Shlomo Hoffman.
Hello, everybody. Welcome to episode 9 of Rubber Bands, conversations about the push and pull of addiction and recovery. We continue to shed light on the world of addiction and treatment by talking to the people who make up its heart and soul, those who have gone through it and those that have helped them get through it, sharing their experiences and insight in how people can find their way back from the darkest places and light up the world for themselves and for those that love them. Today, we have the pleasure of welcoming in Dr. Susan Julius, affectionately known around here as Dr. J. Our Avenues Regional Medical Director is living testimony that addiction treatment works and creates an impact far beyond the person in recovery herself. Her dedication and daring do has earned her the respect and affection of every member of the Avenues organization and anyone she interacts with in the field of addiction and recovery. She is in studio today to discuss her own story of addiction recovery, how medicine and clinical treatment intersect, and her vision of how addiction treatment moves towards the future. Dr. Julius, welcome. How have you been?
I'm great, Shlomo. Thank you for having me. It's great to be here. How exciting.
Well, Dr. J, we're happy to have you here from out west. So tell us, let's start from the beginning, so to speak. Today you are a highly successful physician and running our, Avenues medical program in conjunction with the clinical treatment. But how did you get there? What was your story? Did you start off you struggle with addiction? Did you start off first as a doctor? Sort of run us through how your story happened.
I'd be glad to. Well, since addiction is genetic, I was born with it. So as a young kid, I used exciting things in life to make me feel better. I was into sports. I liked sweet foods. I was the class clown. I liked to joke around. I was the center of attention. I used to love to make people laugh and be happy. And I was a people pleaser. I had 2 brothers that were not well. One was Down syndrome. He was my oldest brother, Mark, and my second and other sibling was my brother, Michael, we didn't know at the time, but as he grew up, he was diagnosed with schizoaffective disorder, bipolar. So I guess I was always the one in the family that was hopefully going to shed some happiness, and I was a caretaker. I was always watching out for my other 2 brothers, and I had to stand up for them.
Where did you come in? You were the oldest?
I was the youngest, actually.
You were the youngest.
So we call it in the medical field, we call it being parentalized early. So they would leave me in charge of babysitting. I don't know if that always was a good idea, but I would take care of my brothers. So as I was always a pretty good student too. I got A's, and I kind of was anal about once I started to get an A, I wanted to keep the A. So
you had to fill up the A's, the A column.
The A column. And they say A is for assholes, B is better. But I always wanted the A, and then it was not enough to get an A. I wanted to have the top A. And so I started putting pressure on myself as the years went on. But in 9th grade, I was 14. That's when I picked up my first most effective reward, which was Boone's Farm strawberry wine. We would go down to the local 7-Eleven. We would all use the same fake ID card, and we'd go in and buy a bottle. And
so it all started with strawberry wine.
Strawberry wine, which I really didn't even like it, but it was sweet and it would get the job done. And we'd chug it and then puke and then chug some more. And we'd do crazy things and stay out late at slumber parties, and then spin the dial. A couple years later, I tried marijuana for the first time. I was 16. And that was the basis of my repertoire until I hit college. And then came the pressure of trying to stay awake and study and cram for exams. And back in my day, they had the white crosses, the yellow Dexies, which were capsules, which is speed, amphetamines, yellow bennies, Christmas trees, black beauties. And I would only use them like right before an exam, so I rationalized it was no big deal. But back then, it changed me. It made me feel great. I felt powerful, all-knowing, and I could cram through an exam, stay up all night, and I was young enough my body could take it.
Was there even an awareness that amphetamine was a was a dangerous thing to go, a dangerous place to go in those years.
It was, yes, yeah, and it was not easy to score. We would do the frat parties on the weekend, drinking. I can remember my first time I ever did acid. It was unintentional. I went to a frat party and I looked down on my cup and there was a piece of brown blotter floating in the cup. And I was like, holy cow.
I just had acid.
Yeah, I just did acid. That was kind of scary. So I was mostly a drinker, some pot smoking for many years. My addiction didn't take me down or, to the depths of hell yet.
And you throughout this, you were progressing through your education.
Yes,
so you were going through medical school.
Yes, I was pre-med. I majored in psychology to bring my GPA up because the sciences were always harder for me. And I minored in theater and modern dance because I always liked that aspect of the cultural, and it brought my grade point up. But this was back in, I'm kind of older, so this was like in 1975, 76 when I graduated from college, and there was high demand, a lot of competition for getting into medical school. And I met with my dean of pre-med advisors, and their job was to weed out at the time. And that's all I needed was somebody to tell me, I don't think you can do this. He told me, the dean told me to take 8 science classes my last semester of college and get A in all of them. And I'm like, are you kidding? And he said, no, that's what med school's like. So that's all I needed. And so I chickened out of taking the MCATs, and then that turned into 14 more years of my life, waiting and debating and procrastinating, which is another symptom of addiction, is we procrastinate.
So what was that 14-year window? What were you doing?
So that 14-year window, I did research, because back then, of course, if you did research and you got published, that would help you get into medical school. Mm-hmm. And the art side of me, this was when aerobics was a craze back in 2000. 1980s. The aerobics was a big craze back then. So I started my own aerobic dance business, and I would work in research during the day. And finally I got published, but I just wasn't happy. I was working in the basement of Case Western Reserve University hospitals, working with labs.
Is that over in Ohio?
Up in Ohio, working with rats all day long.
My stomping grounds.
Yeah? You're from up north too, right?
Native,
yeah. So I liked what I was doing, but I knew it wasn't what I wanted to do for the rest of my life. So, but I was still too scared to apply to medical school. Low self-esteem. That's another major symptom of addiction, not feeling like we're part of or enough. And so I doubted myself. And my dad always used to tell me, you're not going to get a job majoring in psychology. And of course he was right, but who wants to listen to their father, right? So he said,
That's a problem older than addiction.
Yeah, exactly. He said, what about physical therapy? So I applied to go to PT school. And because I didn't have enough prerequisites, I actually had to go to school for a whole nother year. And then I got into PT school at Cleveland State University. And I became...
The Vikings.
Yes. Yeah. Cleveland State. One of the top PTs in the country, believe it or not. Back in the day, I won a scholarship. It's called the Mary McMillan Scholarship. And I'll never forget, my mom, it's part of my 4-step, I guess, owed an immense to my mom. They flew us out to Vegas. And I was one of 6 to win an award. And it was more important to me to go out drinking and partying in Vegas than to hang out with my mother.
Who had come in
who flew in with me for the. So he, the selfishness of the disease, it just, when I look back at it, it just permeated my life, but it's hard to see it at the time, And I didn't drug a lot then. I used schooling and excelling in school and getting A's and studying as my reward. So I worked as a physical therapist, and I didn't really drug then, or just maybe have beer on the weekend with my husband. I got married, but I always felt frustrated when I was working in the hospital system that I just wanted to learn more and know more. I would start reading the charts, and I would hang out on the floors with the internal medicine docs. And before I knew it, I said, you know what? I'm going to go back to school. So I took Stanley Kaplan course, and I studied for the MCATs. And I did okay, and I applied to one medical school. It was early acceptance, and I got into Case Western. And this was at the age of 35, and it was 1991. I got into med school, and it was hard. It was not easy. And I was sober all this time.
And your throw was straight through med school?
I went to med school 91 to 95, And at
So you were
night,
living in Cleveland.
living in Cleveland. And this,
Where in Cleveland did you live?
Lakewood, Ohio.
Sure.
The problem came when the stress in my marriage of taking my husband had been married before, and he had a daughter. And we took her into our family. She would come on weekends. And at one point, she actually was kicked out of her house. She was a very sick child, oppositional defiant behavioral disorder. So she basically turned our marriage and turned it upside down. And that with the stress of medical school, you put it all together. My husband took a lover while I was in medical school. And that was heartbreaking. And so the divorce is what spiraled me down and opened the door to drugs. I used to, I'm like, well, you know what? He doesn't want me. He doesn't love me. I'm going to go out. I'm going to have a good time. And this was the time when I was interviewing for residency matches. So I was flying to Chicago, Florida, Tennessee.
You're getting wined and done.
Yeah. Had a great time, partying, staying up late. I partied one night so late in Chicago, I missed one of my interviews.
Wow.
Yeah, that's how crazy it was. Yeah,
you didn't get that residency.
No, I didn't get that residency. Yeah, I was
Shocking. What were they thinking?
Oh my God. So
how did your medical? So you're doing drugs now while you're studying your residency.
I was
sort of
I
like
was
a
smoking
perfect-
some pot, going out in the clubs, snorting a little coke, and drinking on weekends. And I had lost a lot of weight in that identity of, looking good, feeling that I'm beautiful again. Men are going to want me because my husband didn't want me.
Right.
It gets intermixed. And I thought I wanted to be a surgeon. There was that all competitive, all or nothing. If I'm not a surgeon, I'm nothing. I'm not a doctor. And of course, I picked one of the most crazy, most tough militant program. It's probably a few steps down from Duke, which was Tulane. And I got accepted. I matched at Tulane General Surgery. Spin the dial the very first night. So I had to pack up, go through a divorce, drive down from Ohio to New Orleans. I did it stayed overnight in Nashville. And of course,
you picked the right city.
I picked a really good city, yeah. Packed up, drove from Nashville to New Orleans, and I unpacked my whole U-Haul and put it all away, loaded on coke, straight, 18 hours straight, just unpacked. And I went across the street, went to my first daiquiri bar, frozen daiquiris. You never have that up in Ohio. And who's the first person I meet? A guy that does heroin, Luckily, I never did heroin, but this was the people that I bumped into in my life and made friends with, The very next day, I went down to the quarter and I went out partying. I went down by myself. I went out partying. This was 1995. We rolled a couple joints, actually took them down into the quarter, was bold, smoked them right on the street, went in and out of clubs. And it was late at night and I parked on Royal Street, and I had a little Toyota MR2. It was like Ohio license plate. It's like, hello, please, And I was walking back to the car with a guy I had picked up. I was going to just smoke a joint with him, and, who knows what was going to happen that night. But the cops were there, and they go, don't get in the car. We want you, you look loaded. You need to take a cab back. And I'm like, I was loaded, so I was belligerent. Like, are you just in cahoots with the cab company? What? And so they said, don't get in the car. So they got me in a cab with this guy. We dropped the guy off at his hotel, and as they're getting ready to take me home, I go, no. I want you to take me back to my car. What a dumb mistake. I get in the car. I pull up the street. I pull out on Canal. The light goes off. Boom. So I'm picked up for DUI, and in my purse was a little roach wrapped up in foil. So here I am, the night before starting my surgery residency, DUI and possession of marijuana. I saw my whole life go up in front of my eyes. And I had to call the head of one of the chief doctors in trauma surgery to get me out, Dr. Terry McSwain. He's very famous. He's deceased now, but he was, all the new NOPD knew him and loved him. So he got me out of the clinger. And I got off. They lost the charge for the marijuana. The DUI was dropped down to reckless op, but my fate was almost sealed before I even started. I was a problem, you see. I know I had to go out of my way to always prove myself that I wasn't a screw up, that I wasn't, a drunk or
How did
trouble.
your medical career turn to addiction specialization?
Oh Lord, it's a long story. Well, 2 years of surgery residency, they told me, you know what, you're not good enough, and they canned me. And so now my med school loans were called in. I didn't know what I wanted to be, so I actually switched to family medicine at Ochsner residency program, finished my program, was top of my class, actually, chief resident. There was 2 co-residents at the time, but again, my addiction kind of got in the way. One morning, I didn't go in for early morning rounds.
You ever practice loaded?
I practiced hungover. I practiced high on coke. Yes. Yeah, it wasn't good. Yeah. Finished my residency, started my job, and worked for a couple different companies. And things just didn't seem to go well for me for somehow. And so I decided I was going to run my own business. And that was the really beginning of a real spiral down, because I kept thinking that if I could just have more of me and be awake longer, I could do more. And so, of course, I had the power of the pen, and I found the drug Adderall and Ultram.
And you were able to self-prescribe.
Yes, yeah. And I wrote scripts to myself, which is totally wrong, obtaining amphetamines by fraud and deceit. And back then, Ultram or Tramadol was sampled in little packages. You could get them like the drug reps would bring them. They would bring samples of Panlor Forte, little bottles of hydrocodone, cough syrup. I mean, they were just tons of them in the cupboard, you know. It was nothing to...
It wasn't a big deal for you.
It was not a big deal, yeah. These were the days. This was before, you know, Purdue Pharmaceutical and OxyContin came out. That's what hit. Purdue Pharmaceutical, Oxy came out. All these pain management clinics were coming up. I was struggling as a new doctor, as a provider trying to run my own business. So I thought I'd moonlight at a couple pain management clinics. And what I would always meet would be the wrong people. Always the wrong. And I hired a girl that I shouldn't have hired. She was just as sick as I was. And in opening my medical practice, she would funnel in pain management patients that were basically patients on Oxy and hooked on meds.
I want to go back to something you said a minute ago.
Yeah.
You said, you practice high and coke. Like how come we talk about this all the time? People that are functioning, quote unquote, functioning while they're professionals. Lawyers, doctors. And doctors, all of them have sort of an obligation to to their clients or their patients or whatever, and it's a dangerous place to be. Yes,
it is.
How common is that? Like, I don't want to scare anyone that's going to the doctor. But how common is it to actually be able to perform? You're obviously not going to be at the top of your game.
The crazy thing is the whole time that that I was sick and active in addiction, I thought I was fine, which is the facade, the actual denial of the disease.
Like you seriously didn't think you were putting anyone at risk because you were on top of it. You had this.
The endorphin flood in the brain when you're taking these drugs, opiates, they flood the brain with the dopamine and endorphins, and you can't even tell the true from the false. And so I knew I was doing wrong, but I would rationalize it. That I'm trying to help people. If I just see 20 patients in pain management and I drug test them and I see them every month and I don't write any Soma and I don't write any Xanax with it, that I'm doing okay, and if I see my family practice patients also, that between these two things I can keep myself afloat, because it was not easy as a single provider. But
there's nobody like bosses or anybody that's picking up on this, or that's.
See, I ran my own business, so I wasn't.
Originally you were working for different companies.
So it's interesting that you said in residency, I was late for rounds one day. They asked me to give a drug test, and I refused. When I worked for Dr. Lesser as a brand new doc coming out as an attending, he would see me staying late, trying to catch up and keep up with things. And he called me in his office and said, you can't work late anymore here. One time when I was a doctor on staff at Turo, one of the head director of nursings cornered me in the stairwell and asked me, actually said, I would never say this in a court of law, but I think you should show me your arms. I think you're shooting dope. And I just looked at him and I'm like, are you kidding? And I pulled my sleeves up. And of course, I didn't have any track marks because I swallowed the Ultram pills and the Adderall. But he was so spot on that it scared me. But these were flags that
But you could refuse a drug test, and like what's the consequence of that?
Yeah,
Like, they
and
ask
that's
you for
why I finagled my way into running my own business, because I only held myself accountable.
Right.
I didn't have to perform for anybody. But this, like that charge nurse, that was at a major hospital.
Right.
They didn't fine me. They didn't suspend me. He just gave me his thoughts, and it kind of scared me into realizing, I can't work real late hours when I go there, because I'm not supposed to be up at like 1 a.m. Rounds are supposed to be earlier in the day.
So how'd you look in yourself in the mirror and begin recovery? Like, what was that moment?
I had to get arrested.
Again.
Again.
You got arrested the first night.
Yeah, this was the second time, and
The woman who charged into New Orleans and got arrested.
yeah, it was not good. But it took getting arrested to change my life, and I had to go away to rehab. I spent 3 months inpatient. I stayed 6.5 months at a sober living house, and I worked my 4th step and worked my steps, got a sponsor, went to meetings every day. I had to work for a delivery company for food and deliver steak out. It was great. They hired all people in recovery, that and the Golden Corral. They kept us employed. This was in Warrior, Alabama.
How was it dealing with the fact that you're this, educated person who's a medical professional, who's a doctor, who's delivering?
It was tough. It was tough. I had to humble myself. I think the 2 hardest deliveries were the one day when I had to deliver to a doctor's office, and another time when I had to deliver to an emergency room. It was pretty.
It made you face what you sort of thought that maybe you lost forever.
Yes, but every step that I took was a step in the right direction, and by just staying sober and working my program and doing the next right thing, I plowed through everything that I had to go through. I had to stand up in court and plead guilty to obtaining amphetamines by fraud and deceit. I went through 2 years of probation, paid my monthly fines. I had to earn back my DEA license. They stripped me of my family practice board status. I had to earn that back. 18 years.
What's the process for that?
Oh my God. 18 years later, I had to resit for that exam.
Wow.
And passed the family practice boards. At the age of 58, I sat for those exams.
So your medical license, so you weren't able to practice?
I couldn't practice. Almost 17 months I didn't work. And then when I did work, I had to go back working at a methadone clinic underneath another doctor. And I had to earn back, every time I had to go back in front of the board to get like another DEA level. They gave me Schedule 5, which is basically bull crap. You can't do anything, but it's Imodium. So no insurance company would let you be on their panel. And so I went back and I got a license to dispense medicine so I could hand out legend drugs, which are like Augmentin and hydrochlorothiazide, and work at the homeless clinic in New Orleans. I was the director of New Orleans homeless clinic for a year and a half. And then I was given the chance by Dr. Howard Wetzman to come to work for Townsend. And I spent the next 6 years of my life working at almost every Townsend facility, driving all over the state, working 1 month a weekend at the inpatient facility in Scott, Louisiana. I saw people in Baton Rouge, Lafayette. I opened up the Lake Charles Clinic. And when the Townsend Center opened on Reed Boulevard, I went to work there. It was, I believe in 2016 they opened. I would work 1 weekend a month there. And I loved it. I loved my job. And because I had worked so long at the methadone clinic, I was able to sit and study for the ABAM boards. And I became certified in addiction medicine. But ABAM was never recognized by the American Board of Specialty. So at the age of 58, I sat for family practice boards, and the next year I sat for the American Board of Preventive Medicine boards. And so I'm actually double boarded now in family medicine and addiction medicine. Wow. None of this would have happened unless I got arrested and got help.
Amazing.
It is an amazing story. I'm living
you gotta
proof.
Go find that cop that picked you up. Thank you.
Yeah. They had
Imagine if he would have let you off the hook that night.
I'm very sad to say that the office manager who actually turned state's evidence, she actually died, methadone and Xanax overdose.
Wow.
And she pled, she turned state's evidence against me, so she didn't get in trouble, but it didn't help her. she went on to
she
keep
got off the
she
hook.
went on to keep using. Yeah.
Wow.
And it was a mother. She left three
sliding doors,
beautiful
yeah.
children behind. Yeah. It took what it takes. Sometimes people can hit rock bottom and still not get well, which is terrifying. This disease.
But sometimes you find people that don't have to hit rock bottom.
That's
Like,
right.
I don't
That's
think there's
right.
a message here that
There
you
is-
have to
yeah.
hit rock
No,
bottom.
no,
This is,
no.
this was your story. But we meet a lot of people that somehow got ahead of it, or there was a family member that got
Yes,
involved,
yes.
or they just had their own realization. But it's really interesting how for everybody it's sort of what triggers recoveries.
yeah.
Is a little bit different, right?
The thing that I think was most amazing is in that process, I learned that I should be just Susan and not Susan the doctor, believe it or not. Because the thing that scared me so much was that I was going to lose my medical license and lose my whole career and my life as a doctor.
Sort of where you were hanging your identity on.
Yes. And when I went to rehab, it was at a Bradford Health Services, which took a lot of professionals. And I can remember sitting in group one night at aftercare, this pharmacist sitting across from me and going, "You only are here because you want to get your medical license back." And I looked at her, I go, "What about you? You're a farm, And that really caught me that night. And I had to do a lot of soul searching and self-reflection. And in that process,
Is that a terrible thing? Is that a terrible motivator?
well, we learn in the field of addiction, and we try to teach our patients that having external motivation can be a problem, because when you reach that goal, then what? Now what motivates you? And I can remember standing in the
But
rehab.
I'm really curious about this, because isn't that like a place to start a lot of times?
It is.
Like,
It is. And
people
sometimes
that are in a haze, like they
yes.
need something to get them
Sometimes
through the door,
yes. Sometimes they. I agree with you. But that's where in the process, it took what it took for me to get my help. But in the process, I think is where I learned that I have to live and take care of myself as Susan. And that self-actualization, that's the step I think that actually maybe is what we call the spiritual awakening, realizing I can't do this by myself. I need help. I surrendered instead of fighting everything. There's some doctors who actually will get in a lawyer and try to fight the board of medical examiners, which is not easy. They usually just, when I had to go through 10 years of drug test monitoring, believe it or not, 5 years of therapy, every month, every day getting up, calling the phone and finding out if I had to give a urine drug test, It wasn't an easy program. But what's ironic is after I finished the 10 years, that's when I actually got on the medication called naltrexone. And it was because naltrexone blocks the opiate receptor. And if I was going to slip and go try to drink or take a pain pill, it would not have been rewarding to me.
Right.
So it was kind of like a guardian angel sitting on my shoulder. And the reason I got on it then was my mind started spinning. I don't have to drug test anymore. Nobody's watching me, It
was the carrot.
The cravings.
Right.
You can have cravings anytime, any place, anywhere, and they can come years later. And that's the part that I teach my patients. The amygdala is the memory center of the brain that stores all those memories. And when you actually think those thoughts, there's a chemical released called glutamate, which literally binds in the receptor and sends out surges of the chemical dopamine, which then releases endorphins. And you get high in your head, and you haven't even drank or drugged yet. It's pretty crazy.
Let me ask you this. What are we, as an addiction, in the addiction field in general, I don't mean specifically to, our organization, what are we doing right, and what can we be doing better?
It's a good question. What we're doing right is we're trying to destigmatize the illness. And I think we need to carry this message again and again, every day, all the world over, that people that have this illness, they're not bad people. They're sick and they need to get better. I think the research is out there and trying to help medications so we can use meds as stepping stones. For some people, they need medicine to help bridge the gap from the depth of despair and being so sick and so physically bound to the substance or the behavior that they're taking that they need help. And these medicines can be in the form of vitamins like L-methylfolate. They can be in medicines like Suboxone or Subsolv or Subutex, long-acting medicines like Sublocade. They can be in medications like oral naltrexone, Vivitrol. I'm not saying that some people need these meds every day of their life forever and ever. Methadone is even another drug. Some people do need them as stepping stones. So I would like to see more money placed into research to give us other medication options. Meds that help methamphetamine use disorder, cocaine use disorder, meds that can help people that have severe cravings for marijuana. I also would like to see, they talk about you can't stop drugs, like they did this in the Prohibition time. They stopped alcohol. And what happened is, Dr. Wetzman taught me this, my mentor, high fructose corn syrup, after you can trace sugar and high fructose foods, after booze was stopped, then sugar hit the market. So we're going to constantly cycle from one substance to another. When opium spikes, then there's always a trend down, and then usually an amphetamine or a cocaine substance will go up. So we've seen these opioid trends before. They came back with Vietnam, and now they're trending again. So actually trying to stop the drug, that's, believe it or not, we'll be battling that forever. But maybe helping to use some specific laws to stop bringing in some of these products so that they're not made, staying up on the latest substances of the different fentanyl analogs that are constantly being changed. If we could stay on top of that maybe perhaps the access would be a little bit better. And maybe we even need more research in how to block these kind of drugs, because I'm seeing problems with my patients that they can actually use these substances and override some of the blockade by Vivitrol and Suboxone or Sublocade. So I would like to see more money in research. I think that's one of the best things that we could do, and families and patients with this illness not being afraid, like me right now today. I'm a little nervous about sitting here and telling you that, as a physician, I had 31 felony charges, and it's something that I'm not proud of. But if I can't sit here and tell you this, how can I ask my patients to do that? To be able to tell you this was how sick I was and I needed help, and I got help, and I'm trying every day to live my life to the fullest and to the best, and to not pick up for today. Just for today, I'm not going to use. And if I can't sit here and tell you about my life and how I did that, how can I expect my patients to open up about it? So constantly spreading the word, I think, is something that we need to work on.
How hard is it for you as somebody in recovery to deal on a daily basis with, that challenge of dealing on a daily basis with people that are in active addiction? And, just the trauma, the triggers, sometimes the loss that we experience in the addiction field, all of that, is that like a very difficult challenge for you in terms of maintaining your own recovery?
It is. One of the things I have to constantly remind myself, and I was taught, I cannot control your disease. I can't make you stop. I can't follow you out the door when you leave treatment. And watch you constantly and tell you, no, don't do that. Don't go to that party tonight. Don't get on social media. Don't unblock your dealer. I can't do that. I wish I could go out and follow all my patients, but that's not feasible, and nor is it healthy. So learning where I can help and where I cannot help, and setting boundaries for myself helps keep me able to come back to work every day. One of the hardest things is to watch. We call it AMA, Against Medical Advice. And it's when we have AMAs. We have people leaving treatment. And it can be very demoralizing. You work so hard. The team works hard. The counselors, the nurses, the techs, every single person plays admissions. Every person who plays a role in getting that person into treatment and keeping them into treatment. It's a whole team approach. And when the patient is so sick they can't hear the message and they leave, that can be tough. And we can't really hang our hat on every single AMA that leaves, nor measure our success on our AMA rate. But it's something that is one of the hardest things to handle in a day-to-day life of someone working in the field of addiction. And to learn how to not take it personally is one important thing, but also to learn how to not be apathetic and say, you know what, I can't do this anymore. Just let him go. I'm done. I tried. We tried.
There's a balance between being completely cold and being completely taken over.
Yes. And in seeing the patient or the client come back again to treatment, the first thing I always say is, it's good to see you again, because I would rather see you than not see you.
Right.
I want to see you back, coming back and doing H&I, hospital and institution, and giving your story. But if you can't do that, I would rather see you back in my treatment center than to not see you back. I think there was one month, a few months back, literally 6 or 7 names came up, almost one a week, of a patient that we had lost that had been a prior patient. It's pretty sad. It's this disease is a bad disease. And we have to remember, too, that alcohol is very, very deadly. In the world of the opioid epidemic, alcohol gets pushed aside a lot, and we forget about alcohol. Alcohol's been around and will always be around, and kills a lot of people. A lot of people.
Wow. Do you see firsthand the effects in terms of overdose with everything that's been going on with COVID?
It's been amazing. COVID has changed so many things in the world for so many people. From should we test to not test? Okay, we test all our patients before they come in the facility. We've had to deal with outbreaks in some of our treatment centers, and how to take care of patients safely and get them to where they need to go. We wear masks every day at work, and I'm tired of wearing my mask. I got acne coming out on my face where my mask line is. I can't breathe. I have asthma. I want to eat. How many times did I wash my hands or touch my nose and then rub my eyes? It's so you cannot follow all the rules. It's just impossible. And yet we're supposed to set good examples for our patients.
Right.
COVID has brought so much money out of the furniture and into the hands of people who do need it. But I get sad when I see how they're spending that money.
Right.
I see people who are not going to work because they're paid so well to sit at home. And I don't mean it derogatorily, but I have to call it like it is. I mean, we have such crises now for shortages in nurses, techs, LPNs, RNs. My garbage people, the collectors, the sanitation department, they're coming once every 2 weeks now in New Orleans. It used to be twice a week. So it's affecting almost every line of service, People are actually being paid to stay home and making more money than they would if they actually would work. It's affecting the workforce, And
what about your patient flow? Like
patient flow. Thank
meaning,
God,
is there more? Do you see uptick? Do you see more people overdosing? Do you see more people?
So with that money being, I'm not saying all money given out by the government is being spent on drugs, but there's a good section, And
there's also a loneliness factor. I mean, now sort of the shutdowns.
So they're isolated. They're sitting at home.
Right.
They're not allowed to leave, or they're sick, or their family member's sick, and so they're drugging more. They're drinking more. They're buying drugs. And I want to say one last thing about the nursing. Nurses, my nurses are phenomenal. I have tons of nurses that are giving their lives every day on the front line. People in ICUs, COVID units, people every day on the floor that are working long hours and taking the job and the role of the shortages that are out there. Right. I mean, I've seen that at my facilities. Everybody's put on different hats. So I don't know if this was going to change or when it will change, but I think it's here for a while. I think it's here. It's scary. I feel like I'm living in a movie. When we were kids, we used to watch this show called The Outer Limits. And you remember, you're too young to know Outer Limits, but it's a great show. They control your TV, and there would be a dial and a line on there, and all this sci-fi stuff. And now here I am. We're almost living it. I can't watch shows that about plagues and viral. Right. Yeah, it's just too.
Got to get your mind off of it.
Yeah. People, there's a lot of politicizing too that causes tension, and you don't want to step on other people's toes. And at the same time, somewhere in there, I have to feel okay with what I'm doing. And so I was vaccinated. And I do recommend the vaccine to my patients. And we offer them to get vaccinated. And if those don't want to be vaccinated, I don't push it on them, It's tough. It's a tough day, But I feel very fulfilled and grateful for every life that I am able to touch. And we have a lot of good progress. We see so many people doing better. And we have an alumni through Townsend and Metairie. There's an alumni that on Facebook that they follow up on.
You get to follow up.
Yes.
See how well they're doing.
I
feel like that's also really, really important. We know that it's really important for alumni to stay connected.
Yes.
But not just for the alumni. There's also an aspect for the people that are working in the facilities.
It gives
people
them
like
joy.
you.
Yes.
It gives you a reason to keep going.
Yes, it does.
Like you actually see this mother comes in, she's reunited with her child. That one talks to her dad now. That one has a successful job. That one looks healthy and happy. And I think, when you really, really able to touch the impact that you're making every day, it's not just important for the alumni. It's really, really important for the staff to see that.
I agree.
Have the people come in like, look, this is what we're accomplishing, and this could be. And then even for current patients, they can see like this is possible.
We actually have, a lot of we used to take people out to AA meetings like almost not every single night, but 3 to 4 nights a week and on weekends. And so now when COVID hit, we had to shut that down. So we have to do Zoom meetings. When things cleared a little bit, we were allowed to bring meetings in. So we would also have family weekend. Family would visit. We had family education day. So a lot of things have changed that way. And I teach my patient, I give them a handout on social media. There's a lot of good websites, There's a website called In the Rooms, which I really encourage them to use, or their local AA or NA guide source. Reaching out, at least through Zoom meetings, is better than nothing. And telemedicine, man, it's changed the world of medicine, I think telemedicine's here for good now.
Right.
You'd be surprised how many docs can see a patient that way. I think it's a pretty good delivery of medical care. I still like placing my hands on the patient and hearing that heart rate and looking in their eyes and giving them a physical touch. I think physical touch is really important. And by not being able to physically touch in the world today, it's changed a lot of things. It's changed how we interact. It's nuts. I see two different in different cities, in different, just from one city to another or state to another. The
different
way
protocols,
people,
different way.
for COVID, yeah, it's kind of crazy.
What's your message? Leave us with a message for the people, not even the people that are involved in addiction treatment. I like to ask this to our guests.
Yeah.
Everybody sees it. Everybody's touched by, to a certain extent. With the 6 degrees of separation, what can everybody what are we asking people to do? Even that are not working in addiction, what can I do to make a difference? So
the message I would love to get across is, number one, this is an illness. People are not bad people making bad choices. That two, this disease is not about choice, that it's driven at the subconscious level, and we inherit it, and then life stressors come along and access. And when you put genetics plus life stressors and trauma and access together, up comes the illness of addiction. 1 in 20 have addiction. Some of the statistics even say 1 in 10, but only 10% actually get help. So if we destigmatize the illness, maybe it will be able to bring the people out more so they can go get help. And when they do, that they're not looked at as crazy bad people, and that we need to give them a chance in the world. If I was never given a chance, I wouldn't be sitting here right now today. So try to look at this as a chronic, progressive disease that if we don't learn how to manage it, we won't learn how to recover from it. And to treat it like diabetes or heart failure. And would you tell somebody with diabetes not to take their insulin? No. Why would you tell somebody with addiction not to take their medications that they need, And that's one of the most important things I would do, is please to learn that this is not about being a bad person or making bad choices, that it's an illness. And to spread that word and not be afraid to tell people that you're in recovery.
There it is. And
Thank
one
you.
of the good choices that we've made here in Avenues is obviously having Dr. J on board.
Thank
you so much for
Shlomo.
coming out here. Thank you for talking to us. Thank you for sharing.
God bless you.
Everybody, this has been episode 9 of Rubber Bands, conversations about the push and pull of addiction. Please listen, subscribe, and rate. Once again, we will see you next time. This has been Rubber Bands.